Bismillahirrahmanirrahim. Distinguished participants and speakers, ladies and gentlemen, konnichiwa, assalamualaikum and good day to all. Welcome to webinar on responding and preparing for natural hazard under the COVID-19 pandemic, sharing challenges and lessons from Malaysia and Japan, live from MJIIT studio via Zoom platform and also the PPC Facebook page. First, let me introduce myself. My name is Kamarul Azhari Razak. I'm the Director of Disaster Preparedness and Prevention Center, DPPC, of Malaysia Japan International Institute of Technology, MJIIT, University Technology Malaysia, Kuala Lumpur. I will be responsible for hosting today's webinar session alongside with Associate Professor Dr. Sohi Matsura, our JICA expert, and also Associate Professor Dr. Azna binti Nur Anwar. I would like to express my gratitude to everyone who sincerely committed to this event to make it success. This event would not have been impossible without the support of each and everyone present here. We would like to thank to Embassy of Japan in Malaysia and Japan International Cooperation Agency, JICA, Malaysia office as co-organizer for our webinar session for today. This webinar is organized as part of MMJD 1293, Healthcare in Emergency and Rehabilitation course under Masters of Disaster Risk Management MDRM program. The objective of the event is to share the challenges and lessons in Malaysia and Japan on responding to compound disaster under COVID-19 pandemic and suggest the way forward to better reduce and prevent future disaster. If you wish to know more about Master of Disaster Risk Management, you can go to our website. Just a little housekeeping before we get started. If you have any question during the sharing, please type them into a question box in your Q&A button at bottom or leave your question in the comment section of DPPC Facebook Live. We will collect all your questions during the expert session and have the panelists answer all questions during the panel discussion sessions. Before we start, perhaps Dr. Matsura have something to share with us today. Dr. Matsura, please.
Thank you, Dr. Kamarul. I would like to also welcome everyone joining online and also to mention that this year marks the 10th year anniversary of Great East Japan earthquake and tsunami, one of the most devastating and the most costly disaster happened anywhere around the world in a single event. And for us, the Japanese partners involved in this program, our mission is, of course, to share as much as we can regarding our experiences dealing with disasters and also taking the preventive and preparedness measures to it. And this webinar, hopefully, will be one of the significant part of our efforts in working with our Malaysian friends and partners. So with that said,
thank you very much, Dr. Matsura. Indeed, it's our great commitments to support the Sendai framework indeed. So without further ado, I would like to invite Yang Berbahagia Professor Dr. Ahmad Ismail, Vice Chancellor of University Technology Malaysia, UTM, for his welcoming remarks. With all due respect, please welcome.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Konnichiwa. Salam sejahtera and good afternoon. Yang berbahagia Tan Sri Dr. Jemilah Mahmood, Special Advisor to the Prime Minister on Public Health, His Excellency Ambassador Hiroshi Oka, Ambassador Extraordinary and Plenipotentiary of Japan to Malaysia, Mr. Masahiko Takizawa, Chief Representative of JICA Malaysia. Yang berbahagia Datuk Hussein Omar Khan, Director of Operation, National Disaster Management Agency, NADMA Malaysia. Dr. Shinji Akitomi, Director, Department of Medical Crisis Management, Medical Corporation, Luakai, Japan. Dr. Naoki Sakai, Chief Researcher, National Research Institute, for Earth Science and Disaster Resilience, NIED, Japan, Mr. Said Al-Hudzari Ibrahim, General Manager, Program Operation, Mercy Malaysia, and all distinguished participants joining online today. It is with great pleasure that I am engaging with all of you virtually today to the webinar on responding and preparing for natural hazard under COVID-19 pandemic, sharing challenges and lessons from Malaysia and Japan. Before I proceed further, I would like to extend a special welcome to everyone joining us today. To the many media representatives, thank you for coming to this event. We hope that with your wide coverage, many people, many more local will be made aware of the event. Ladies and gentlemen, on the 12th January 2020, the World Health Organization, WHO, announced the cause of this epidemic outbreak was a novel coronavirus discovered in 2019. 2019 nCoV or SARS-CoV-2 and named the disease coronavirus disease 2019 or COVID-19. However, the answers to the origin of SARS-CoV-2 remain to be determined. The first case of COVID-19 was detected in Malaysia on the 25th January 2020, which was traced back to 3 Chinese nationals who previously had close contact with an infected person in Singapore, and immediately they were treated at Sungai Buloh Hospital, Selangor, Malaysia. The Ministry of Health Malaysia quickly devised standard guidelines for the management of COVID-19, and 34 hospitals and screening centers were specifically designated in each state of Malaysia. However, with the increase in the affected cases, the Movement Control Order (MCO) was implemented on the 18th March and was in place until the 28th April to control the spread of COVID-19 nationwide. This was unprecedented, and every individuals as well as the operation of different sectors were greatly affected. Like all other entities, UTM too was hit severely by the spread of the COVID-19 pandemic. We are proud to say that in the wake of the COVID-19 pandemic and the nationwide movement control order, University Technology Malaysia UTM has set up a special crisis task force to deal with
Yeah, I think we're facing technical difficulties. Shall we? Okay. Shall we wait or continue? Okay. Yes, these technical
Yes, indeed, Dr.
issues
Masrur.
are very common.
Indeed.
Still after a year
absolutely,
of this
absolutely.
online.
So while waiting, perhaps I take this opportunity on behalf of the organizer. Would like to welcome all the guests to our media rooms today, and also to those who just enter our Facebook Live. Perhaps you can have some new idea, perhaps to support the government's commitments towards COVID-19's response and recovery, Dr. Masrur.
Yes, we would welcome your comments and questions regarding the upcoming expert speakers, either by comments on Facebook or from the Zoom the chat functions on the Zoom platform. So we would take note of your questions and comments as well.
Yes, indeed. If I may give some a quick input, that there are four experts are invited today, two from Malaysia and two from Japan. So they will be sharing with us some new insight into COVID-19 pandemic, as well as
management team
climate change and the disaster. So I think we are ready, Dr. Mansura. So let's proceed.
and frontliners remain creative in finding the best alternative in terms of student and staff welfare. To date, a significant sum has been successfully raised through the Tabung Kas Bantuan COVID-19 UTM, and in-kind donation such as food donation and daily necessities. Thank you to all the contributors, especially to the alumni who work together to support this initiative. Ladies and gentlemen, University Technology Malaysia community responded to COVID-19 threat through R&D researchers from University Technology Malaysia, UTM, has swung into action to respond to the threat posed by COVID-19 pandemic. UTM had taken the initiative in working with University of Technology Delft from Netherlands and the Ministry of Environment Malaysia in research to improve scientific ways to curb the spread of the COVID-19 virus that could spread throughout the sewerage system. In addition, UTM also offered expertise in assisting frontline personnel, such as the provision of personal protective equipment, PPE, and so far around 700 unit face shield were distributed. At the same time, frugal innovation and invention were developed to improve efficiency and quality in creating relevant and adaptable solutions for the healthcare industry. An emergent, innovative, mixed method research strategy and tried and tested processes were employed to ensure effective solution for the frontliners and healthcare personnel. UTM felt privileged to support the health workers and doctors from hospitals and medical institutions in Johor, Klang Valley, and other states in Malaysia with various technological products developed by the researchers of UTM. Among these, the following are worth mentioning: I3S cubicle for COVID-19 screening, MCK-19 delivery robot, aerosol box or intubation box for intubation procedure, ventilators and splitter kit, 3D printed face shield and hand sanitizer. Hand sanitizers were produced in-house using various expertise and facilities available on campus, which were distributed for students, security unit, and health workers around the campus. The development of this frugal innovation was done while collaborating with health professionals, researchers from other universities, and private companies for the benefit of the country. Ladies and gentlemen, I would also like to congratulate the Disaster Preparedness and Prevention Center, DPPC, of Malaysia, Japan, International Institute of Technology, MJIIT, University Technology Malaysia, on its successful track record in disaster risk reduction and prevention efforts, as well as in organizing impactful events, both virtual and physical. Although not directly related to the COVID-19 pandemic, DPPC is trying its best to fulfill the Sendai Pledge in mitigating the disaster risk through research, providing quality education, and involving with the community directly to create awareness among the people from the disaster-prone areas. Besides all local partners, the great support of Japan government through the Embassy of Japan in Malaysia, as well as the Japan International Cooperation Agency, JICA, is assisting us to a great extent in the MJIIT project and DPPC-led local implementation in disaster risk reduction and management in Malaysia. We do wish to increase the global visibility of DPPC and promote its disaster risk reduction (DRR) commitment, and thus harmonious relationship with the stakeholders is of utmost importance for us. From our stakeholders, we can learn from their vast experience in their areas, and at the same time, we will be able to utilize that knowledge to develop new policies in designing efficient and effective disaster risk reduction program in Malaysia and all around the world. Let us all work hard for the better, safe world, and we play our role to prevent future disasters, inshallah. With Bismillahirrahmanirrahim, I welcome all of you to the webinar and responding and preparing for natural hazard under COVID-19 pandemic, sharing challenges and lessons from Malaysia and Japan. Once again, thank you all for your kind attendee. Arigatou gozaimasu. Thank you. Terima kasih.
Thank you very much, Professor Datuk, Dr. Ahmad Fauzi Ismail, Vice Chancellor UTM. Now I would like to ask for your kind attention to listen to the opening remarks of His Excellency Hiroshi, Japanese Ambassador to Malaysia.
Chancellor Dr. Jemilah Mahmood, Special Advisor to the Prime Minister on Public Health, Professor Dr. Ahmad Fauzi Ismail, Vice Chancellor, University of Technology Malaysia, UTM, Mr. Takizawa Masahiko, Chief Representative, Japan International Cooperation Agency, JICA, Malaysia. Distinguished guest panelists, ladies and gentlemen, good afternoon. It gives me a great pleasure to attend today's webinar organized by Malaysia-Japan International Institute of Technology, MJIIT, and University of Technology Malaysia, UTM Kuala Lumpur. This seminar is timely and informative thanks to the participation of our esteemed and learned panelists, as well as the detailed planning of the organization. I'm deeply grateful to the organizers for making this event happen, and I heartily welcome all the participants from near and far to this webinar. First of all, let me express my deep appreciation to the Malaysian government and all the frontliners for their dedicated efforts to keep us safe in Malaysia in the face of the unprecedented challenge posed by COVID-19. Thanks to the sound policies put in place by the Malaysian government, we are witnessing a steady stabilization of the infections, and the economy is also starting to recover thanks to the government measures, including the start of the nationwide vaccination. By working hand in hand together with Malaysians to overcome the challenge posed by COVID-19, we reaffirm the precious and valuable friendship between Japan and Malaysia. This webinar could not have come at a more appropriate time. The COVID-19 pandemic has taken so many lives around the world and completely changed the way we live since it started more than a year ago. This webinar will enable Japan and Malaysia to share each other's experiences, knowledges, and lessons learned from this pandemic. It will also help us to overcome challenges, adapt to the new normal, and hopefully to recover from the damage caused by COVID-19. Today's seminar will address the challenges posed by COVID-19 from the perspective of disaster management, which is one of the MJIIT's key focus areas. MJIIT was established in 2011 as a faculty under UTM through JICA's G2G cooperation to promote Japanese-style education. Since its foundation, more than 1,000 Malaysian students have graduated from MJIT, and there are now 9 Japanese professors teaching at MJIT. Thus, MJIT symbolizes successful cooperation between Japan and Malaysia under the long-running Look East policy, which will celebrate its 40th anniversary next year. As you are all aware, Japan is prone to many types of natural disasters, and therefore disaster risk management is one of MJIT's educational focus. For instance, MJIT offers master course for disaster risk management and developing future leaders in the field of disaster management. In fact, some of the graduates from this master course have spearheaded the government's efforts to formulate SOPs to prevent the spread of COVID-19 and set up quarantine stations for the country. Within MJIT, the Disaster Preparedness and Prevention Center, DPPC, was established to serve as a platform to build networks, organizations, and professionals in the field of disaster risk management. The center will also provide scientific basis to plan and implement disaster risk management and reduction measures. We hope that the center will be a world-class research and training center for building resilience to natural disasters and climate change. We still vividly remember the devastation caused by the Great East Japan earthquake, which struck Japan 10 years ago, March the 11th, 2011. Nearly 20,000 people lost their lives because of the earthquake and the ensuing tsunami, and thousands are still missing today. Though this was a painful experience, undoubtedly, it was also an opportunity for us to realize the precious bond of friendship we have with so many countries in the world. In the aftermath of the Great East Japan earthquake, Japan received countless support and messages of encouragement from countries all over the world, including Malaysia. The Japanese people were very touched by the expression of heartfelt sympathy and warm support from the Malaysian people. A special motion was adopted by the Dewan Rakyat, Emergency
Yes, okay. Yeah, Dr. Masura. We have some technical issues, I believe.
Yes, it's coming back up.
Yeah,
soon,
okay.
Yes.
Yeah, it will come to the second part of the session.
Well, we often talk about disaster preparedness, and we are disaster scientists who advises preparedness, but it seems that we are never prepared for this kind of technical disasters.
Yeah, Dr.
Yes.
Masura.
from countries all over the world, including Malaysia. The Japanese people were very touched by the expression of heartfelt sympathy and warm support from the Malaysian people. A special motion was adopted by the Dewan Rakyat. Emergency supply of LNG from Malaysia helped keep the Japanese economy going. Humanitarian assistance teams from Malaysia arrived in Japan. Thanks to these precious support, Japan has now managed to reconstruct the affected areas in the country. State-of-the-art disaster management technologies is effective, particularly to enhance disaster preparedness. However, hardware technologies alone would not be effective enough without software policy measures to supplement hardware for all the phases of disaster management. We consider it our vital contributions to humankind to share the lessons we have learned from the disasters with the international community, so that our lessons and experience can be used to mitigate the impact of the disasters for the international community in the future. Building on the emphasis on the international cooperation for disaster risk reduction, DRR, Japan has strengthened its assistance in the field of disaster management since the last 10 years after the Great Japan earthquake. For instance, Japan contributed to the vision of DRR to be incorporated into the Sustainable Development Goals, SDGs. Furthermore, in 2015, Japan hosted the third United Nations World Conference on Disaster Risk Reduction in Sendai, which is close to the affected areas, where we advanced the concept of the Build Back Better as a commitment shared by the international community. This conference was attended by the then Malaysian Deputy Prime Minister Tan Sri Muhyiddin Yassin. Since this conference, Japan has worked closely with Malaysian government on disaster risk management, especially through JICA technical cooperation, including capacity building training based on the Sendai Framework for Disaster Risk Reduction 2015 through 2030, which was adopted at the conference. Thanks to JICA's active role in the field of disaster management, we have now developed close and effective practical working relations with NADMA. Before closing, let me briefly touch upon how Japan and Malaysia have worked so closely together to cope with COVID-19. Japan stands firmly with Malaysia in the fight against COVID-19, and the Japanese government has been providing various support to the Malaysian people, including the supply of PPEs for the socially vulnerable people and frontliners through international organizations in Malaysia. Also, bilateral grant assistance of sophisticated medical equipment and the supply of Avigan tablets for the clinical trials will be provided to Malaysia. Japan also supports the establishment of the ASEAN Center for Public Health Emergencies and Emerging Diseases to help ASEAN countries cope and develop their capacity to cope with infectious diseases. In addition, the Japanese government recently announced the additional new assistance to provide cold chain equipment, such as cold storage facilities and transportation to 25 countries in the Southeast and Southwest Asia and the Pacific Island region, including Malaysia, through UNICEF. In Malaysia, we are now in the process of coordinating with the Malaysian government for the implementation of the newly announced project. This will serve as the last one-mile support to ensure vaccinations in each and every country. Meanwhile, Malaysia had helped Japan tremendously by providing emergency supply of crucial PPEs to protect the Japanese frontliners from the risk of COVID-19. The Malaysian government permitted the export of PPEs and medical supplies and equipment manufactured by Japanese businesses in Malaysia, so that the contributing towards ensuring that Malaysia remains as an integral hub of the medical supply chains. Before concluding, I would like to thank all those who have worked hard for this program, and I heartily wish you all great success for the seminar. Thank you very much. Terima kasih.
Thank you very much, His Excellency Hiroshi, Japanese Ambassador to Malaysia. Now I would like to continue to introduce Chancellor Dr. Jemilah Mahmood, Special Advisor to the Prime Minister on Public Health. But before I give the floor to Tansri, I will briefly introduce her. She's a medical doctor and the founder of Mercy Malaysia, one of the key and the most active humanitarian NGOs in Asia and other parts of the world. Tansri also was the Under Secretary General of Partnership for the International Federation of Red Cross and Red Crescent Societies, or IFRC. And in 2016, she was also leading as chief for the first World Humanitarian Summit of UN OCHA. So we are very pleased and honored to receive Tansri, Dr. Jemilah's keynote speech. So may I give the floor to Tansri, please.
Assalamualaikum and salam sejahtera. Good afternoon to all. Konnichiwa, minasama to ai dekite koi desu. So I'm very thrilled and honored to be here. Your Excellencies, Vice Chancellor, distinguished guests, because it also gives me an opportunity to speak on a subject that really brings me a lot of good memories from my time actively involved in the humanitarian field. It also is very special because many perhaps do not know that my relationship with Japan is a very special one. Having been an exchange student as a medical student with JICA University, having been a fellow of the JSPS in Tokyo University Medical School, and later on working very closely with the Asian Disaster Preparedness Center in Kobe. So I have been to every single negotiation from Hyogo to Sendai, and it's really a pleasure to see Malaysia collaborating so closely with Japan in an area which Japan is so respected for, and that is disaster preparedness and disaster risk reduction. As I reflected on speaking to all of you today, I wanted to look at where we find the synergies and the learning and the challenges in actually looking at both the disaster preparedness and pandemic lens. For many years, we convince ourselves that disasters can be prevented, and more so, pandemics can also be prevented. We know that disasters happen as an interplay between risk and vulnerability. And one might even use a simple formula that disasters equal hazard over vulnerability. We can't change many hazards, but certainly we can reduce vulnerability and therefore reduce the risk of disasters. And I think this is where Japan has led the way, not just from a policy level, but also in terms of your investment in disaster preparedness and risk reduction. As mentioned before, 10 years ago, Japan was rocked by the Tohoku earthquake and tsunami, and yet again stood up tall in the world to lead us into new thinking around the Sendai framework. And that provided really a framework that brought an all of society approach, not just for governments to contribute to disaster risk reduction, but also the private sector, civil society, and society at large. And this is extremely important because we know that you can have the best policies, but if people's behaviors and specific action is not taken, risks remain very high. So as we reflect upon the pandemic, are there hazards that could have been prevented so that we can actually reduce vulnerability and therefore risk of facing another pandemic? For the last 6 years, I remember working at the UN and IFRCs, we have constantly confronted ourselves with this. The pandemic is a question of when and not if. There were so many telltale signs, so many early warning signals, just like in disasters, where we have seen the outbreak of SARS, of MERS-CoV, and other coronaviruses that have warned us of the fragility that we are facing and the risk of another disease emerging. And lo and behold, in 2019, 2020, we have been struck by COVID-19. So where are the intersections then between the pandemic and disaster risks? The pandemic did not arise out of the blue. The pandemic arose because of our development globally that has really, transgressed a lot of what we call the planetary boundaries, environmental protection, the planet, social disruptions, and therefore making zoonotic diseases something that occurs more frequently, displacing wildlife and relationships between man and wildlife that has also led to pandemics being on the rise. If you look at that formula and you look at, this risk that I've underlined that have actually led us to where we are now, we know similarly if development is haphazard and unplanned and creates risks, if environment is not protected and resources are damaged, we will face similar risks as well in terms of disasters. And we've seen the direct impact of all this greenhouse gas emissions on the climate. And climate change will be one of the biggest risk factors that will actually lead us to more and more disasters happening, or exacerbating them, or creating weather events that are extreme. And we see this all the time. Now, what happens when risks collide? And I think this is what we fear. In Malaysia, we had flooding recently, and at a time of a pandemic, the disaster management agencies had to step up, not just to manage the pandemic, but also to manage the floods. And in doing so, we need to be very cognizant of public health measures that need to be protected. How do you then take care of people who are displaced by the floods? How do we make sure that when we actually house them in settlements for the floods, we do not increase their risks of transmission of COVID-19? And this therefore requires, an all of government and all of society approach again to look at how we communicate those risks, how do we plan for those events, and what do we do to prevent further complications? How do we make sure that the result of one crisis does not compound the other? And this is going to be the trend in the future, because we will see colliding threats happening more and more with climate change, with health crisis, and also particularly in some areas of the world, conflict as well. So I think that there's a lot that we can learn from each other, and there's a lot that we can do better in terms of collaboration and also looking at the science and data, because even whether it is a pandemic or whether it is a management of a disaster, there is a lot of data, science, and technology that is required. I really want to congratulate Japan for agreeing to support the ASEAN Public Health in Emergencies and Emerging Diseases Center, AFID, because for a long time, I personally, as a medical doctor and also someone who's been dealing with disasters and pandemics, have felt that our region should have its own so-called CDC, or Center for Disease Control. So this is really the opportunity that Japan has funded the establishment of the center. But I also think that this requires all governments in the region to then invest in the center that Japan has started to fund, because we will then not be faced with issues like, how do we manufacture vaccines? Why aren't we the ones innovating to find the science and technology behind vaccine production, producing kits, detection of cases, and so on and so forth? If we as a region are the ones most impacted, not just by disasters, as you know, Asia Pacific is really the most disaster affected region in the world. Similarly, Asia has also been one of the areas very badly hit by pandemics as well in the past and currently. So in closing, I want to leave you with maybe 5 thoughts that we should all consider as we look at where the intersections between disaster management or disaster preparedness or DRR and pandemic preparedness. The first, I think the learning that multi-agency efforts are critical. Just as you want to strengthen disaster management and require that multi-agency involvement, the same applies to pandemic management. So the establishment of interagency task forces. In Malaysia, we have the NADMA that leads this, National Disaster Management Authority, and how they engage with other stakeholders. And similarly, in a pandemic, NADMA plays an extremely important role, particularly because of the experience that they have in managing crises. And then, of course, working with the Ministry of Health to make sure that the health aspects of managing the crisis are covered. The second point I would stress is that you need to find a balance between centralized and local approaches. Whether it is a disaster preparedness and risk reduction approach, and Sendai certainly have this in place, requiring, for example, reporting of the national action plans that go down to district and local levels. Similarly, managing a pandemic requires both a central driving policy agenda, but also local action that actually determines the outcomes of the pandemic. Health interventions are only a small proportion of managing a pandemic. The majority of the success will come when people take public health measures and behave in a way that do not allow the virus to transmit. So how do we make sure links between central and local government, whether it's state or district, is well-founded and the collaboration is clear and it works well, whether it's in a disaster or a pandemic. The third, I think, is flexible and agile arrangements are required to help governments respond effectively and quickly to different emergencies. Within institutional structures, such measures can be put in place before a crisis occurs. For instance, you can map out existing staff capacities, such as number of staff, areas of expertise, and how effectively they respond to crises. And then review the mandates of key departments, updating their responsibilities, identifying how different ministries can actually work together in different types of crises, identifying how to balance different legislations and ensure checks and balances are there during a state of emergency, and conducting an analysis of how government can optimize their current arrangements and structures, and identifying systems or areas that need to be strengthened. Fourthly, data and technology can support not just government, but everyone for quick and effective crisis response. We have seen the public rising to this. We have seen movements like Kita Jaga Kita arising from the rakyat or the citizens themselves, supporting each other, the humanity that emanates. And as mentioned by His Excellency, the Ambassador, you see this all the time in the aftermath of a disaster. How do we harness this? How do we make sure that we use this opportunity of the pandemic to really drive the fact that we can only be stronger if we work together and humanity prevails above everything else? So how do we then protect data, especially now with everything being driven through a digital agenda? We've seen the technological challenges we face even on a Zoom call. But how do we look beyond that? The data protection and what kind of technologies are there? How do we safeguard privacy without violating human rights? Where are the balances and where are the compromises you make in terms of rights or privacy in order for you to curb a disease and get to people? This has been very challenging. And finally, public trust is key to enable and safeguard people during any form of crisis. During the pandemic, public trust in governments contributed to persuading people to change their social behaviors. And the same thing was done by civil society organizations who were on the ground working with people and communities. I think that openness in sharing data and information, being transparent and communicating to the public using very clear and evidence-based messages can really help all stakeholders, whether it's government or non-government, to gain trust. Many people think or have a perception that Japan is so successful in its disaster preparedness and management because they have lots of money. Yes, they do, thankfully, but I think it's beyond that. It's the attitude of the people of Japan. It's the education system that has built in knowledge, preparedness, and an understanding by children, supported by their teachers. It's also about behaviors, about hygiene, about important things like wearing a mask, even before a pandemic. You see this as a frequent practice in Japan if you're in public transport or other public spaces. Cleanliness and hygiene. The COVID-19 pandemic has been an opportunity for Malaysians to really step up in all these areas. And we've seen a very drastic fall in the incidence of flu or other communicable diseases because Malaysians have been taking very good public health measures. So I leave you with these thoughts on how you might navigate your further discussions later in looking at these intersections, in looking at the colliding threats that we will be faced, and in looking at how we look at things from a planetary health perspective, that if we do not protect our planet, if we do not control the way we develop to make it sustainable, if we do not embrace the sustainable development goals, which we know we will not be able to attain by 2030 because of this pandemic, but what then do we need to do further and how do we learn from each other? I think that there are many structures that already exist. We need to build on them. We need to engage with our own network of family and friends to further build and foster this knowledge. And as we've learned and will continue to learn, disaster risk reduction, pandemic risk management relies on people and communities. And as we work, and if we work as a collective unit, the impact can be felt at the individual level. Arigatou gozaimasu. Thank you very much, everyone. And it's really been a pleasure to be invited to speak to all of you.
Thank you very much, Chancellor Dr. Jemilah Mahmood, Special Advisor to the Prime Minister on Public Health, for your encouraging insights and words. We indeed, well, the concept of this webinar is indeed about working together and taking the all of society approach, and also listening to the field, the local levels, so that the government can properly support them in this time of crisis. Well, with that said, we would like to move to our next session, which is the expert talk session, but we'll take a short break for us to prepare the speakers to be online. So please enjoy this short video. Sorry, excuse me. We would like to, before our short break, we would like to do a virtual group photo. So for those who are online, please turn on your camera so that we could take your photos. Please don't be shy. We'll give you 10 seconds, 15 seconds to turn your video on. Okay, thank you very much. So we'll take a short break and come back with the expert talk session. Thank you very much. Participants. We're now starting the expert talk session. As Dr. Kamaru briefly explained before, we have experts from both Japan and Malaysia and from different fields. Some are medical doctors, some are disaster scientists, some have extensive experience in working with community, and we also have government departments that coordinates all these efforts. But before that, I would like to introduce my colleague, Dr. Asna, who is actually coordinating one of the courses in our Masters of Disaster Risk Management on healthcare in emergency. Perhaps Dr. Asna can briefly explain what the course is about, and maybe some of the audience will be interested to actually take this course.
Assalamualaikum and good evening, everyone. Talking about the course that we are running now, healthcare in emergencies and rehabilitations. So the participation is still open for the public. So we start our classes actually on 15 March and will be ended 26 March, which next week. So we have a 2 weeks course. And I think this is a very good time actually, since we are now in the era of COVID-19 challenges. So if you are interested to learn, okay, from the experienced person, especially from the Japanese countries and also Malaysians, we arrange a very good speakers for this course. And if you're interested to join this course, kindly check on our DPPC website.
Okay, thank you, Dr. Asna. During the expert talk session, you may have some questions that you would like to ask the panelists, the talkers, the experts. So we would we are able to receive questions on the Zoom chat function. And also if you're on Facebook Live, you can comment your questions. We'll try to read them and compile them as much as possible. And at least some of your questions will be answered in the last half of the panel discussion, which will be our next session. So please do ask a lot of questions, and we will be answering some of those. For Zoom participants, there will be simultaneous Japanese-English interpretation. If you like to hear the English, you don't have to change anything. You just listen to your current channel. Yes, our Japanese speakers will actually be speaking in Japanese, but there will be English translations. So without further ado, I would like to introduce our first speakers. His name is Shinji Akitomi. He's a medical doctor, as well as a PhD in engineering. And he's now the director of Department of Medical Crisis Management, Medical Corporation Yokai in Japan. He has extensive experience in emergency medicine and disaster management. And he was one of the key coordinator for medical care and victim support during the East Japan earthquake and tsunami while he was at the Iwate prefectural office. He's also working members of several committees in the Cabinet Office, as well as Ministry of Internal Affairs and Communications, and also Japan Medical Association. And he's also one of our Master's MDRM course lecturers. So I would like to, ask Dr. Akitomi to start his presentation. Thank you.
松浦先生がご紹介いただきましてありがとうございました。今回、日本から日本における COVID-19 対策についてお話しさせていただきます、秋富でございます。去年の2月から6月まで日本医師会長のアドバイザーとして活動していました。今回、このような貴重な機会をいただきまして、マレーシア工科大学の皆様、外務省をはじめとした日本大使館、JICA の関係者の皆様に深く、感謝申し上げます。ここまで通訳お願いします。すみません、通訳は大丈夫でしょうか。日本語は聞こえます。どこまで住んでますか？あ、わかりました。はい。日本は全般的に感染者が少なく、国際的に評価されているところがありますが、本日は前向きな意見として今後改善すべきことを中心にお話しさせていただきます。特に医療から見た COVID-19 についてお話をさせていただきつつ、できたこと、できなかったこと、こうすべきだったことについてお話をさせていただきます。まず、COVID-19 の本質についてお話をさせていただきたいと思います。COVID-19 はとてもトリッキーなウイルスであるということを共通認識しなければならないというふうに思っております。症状がないのにもかかわらず感染力あるウイルスは前回ではありえないウイルスですが、実は2010年頃より COVID-19 のようなウイルスの出現には警鐘を鳴らされていました。私個人の意見ですが、今回 COVID-19 というのは人を殺すような生物テロの要素ではなく、経済テロという側面を持っており、医療だけの議論ではダメだったということを感じております。また、従来通りの新型インフルエンザやエボラ出血熱などの隔離対策では対応ができない新しいタイプのウイルスと分かったときに、それに適した対策を取れたかどうかが鍵でした。さまざまな課題が出てくる場合、それは想定外と言っても良いものでありますが、そのために必要なファンクションを考え、それぞれでタスクフォースを作るべきであったのではないかなと思っております。そこで COVID-19 を対策するために必要な支援項目を考えてみました。それぞれのこれら22項目を考えましたが、それぞれでタスクフォースを作り、官民一体の対応システムが必要だと訴えてまいりました。実際にできたことは少なかったのが現状でございます。理由としましては、日本は緊急事態に対して対応する組織がしっかり存在していないということもあり、今回の COVID-19 の対応が一部の厚生労働省の組織だけで対応していたこと、COVID-19 の対策案が設置された後に2、3ヶ月おきに担当者が交代したりしたために中長期的な対応ができなかったことなどがあるのではないかなというふうに考えています。ここでは、例えば ESF1 であるトランスポーテーションの話であれば、例えば事前にですね、輸送業務維持のためにそれぞれの関係者への感染防護提供と感染対策のアップデートの提供を考えていけるのではないかなというふうに思っております。また、病院だけでなく、
In addition, not only to hospitals, it was important to provide PPEs to other key sectors and industries in order to ensure continuity in their services. In addition, we also early on realized on the need for vaccines, and more could have been done in terms of ensuring a supply as well as planning for distributions. So there were many things that we were able and unable to do in hindsight, but as far as our medical association was concerned, we established different project groups in order to provide necessary assistance. We got and brought together private sectors relevant to each of these in order to more effectively act in response to the needs we faced. So one of the major issues that we faced was before COVID even came into effect, how much budget had we set aside in order to deal with these kinds of emergencies? As far as the American CDC, they had set aside close to $1 trillion in order to, in the event of such eventualities. But in Japan, the budget allocation was woefully low in comparison, as shown by this slide. And the chart on the right shows how different countries were able to allocate money for COVID measures. You can see the big gap in between Japan and other countries. Although both the government servants and the private sector spent sleepless nights in order to deal with COVID, there was more that could have been done in hindsight. It was not only enough to come up with plans to come up with dealing it, but even within the health ministry, because work was being burdened on just one small section, they were having to deal with more than 350 hours of overtime per month, and they were working in a very cramped quarters. And so as far as we were concerned, we made various proposals in order to deal with the situation. But the difficulty lay in the fact that we had to build something when there was nothing to begin with.
In Japan, as for crisis cases, there is a various type of the system. So how to enhance the efficiency, and then there is some delay because of the efficiency of the system operation. The first outbreak response in Japan was an incident that occurred on a cruise ship. Although it was first time, the response was progressed. So notably, we were able to contain the COVID-19 on the cruise ship. But however, the transportation of the positive people, there was a lack of infection protection equipment, and inexperienced people wander around the ship and cannot respect the zoning. In some cases, DMAT and personnel were infected in addiction. These are the issues that we are now challenging in the future. So we have to overcome the problem. They had to set up this various system. So we are now system to collecting all the responding information, and then SARS. This is the way to handle the information of the positive patient. So it's a centralized information collecting system. So there is a point, there is a cases that we can do better, but there is a things that we cannot do that. So this is a very difficult system that has all the information has to input, then have to utilize the information. Otherwise, in prerequisite condition, that the system has to be comprehensively allowed everyone to input all the information before have to take an action. So the virus invasion, which is unknown virus infection. So our government system is vertically divided. So this is under such a difficult situation. We have to come up a certain system to have the system to get response to the policy. And then we relate to the academic and then medical side to take the correct action to the pandemic situation. So the WHO or the Japanese government, before they have the crisis sensation, so there is Mr. Yokokura is the honorary chairman of the Japan Medical Association. He has warning us currently what is important is to try to develop a system and build the human capacity to materialize all others approach to deal with the various threats with the flexibility and establish a network with experts of different scientific society for each others. So medical group is expected to contribute as one of the wing of this support. This is actually ideal feature that we have academic and medical side to work with. So we have to encourage the strengthen the system for the future disasters. So Malaysia and Japan also have to establish a better environment to work together. And in Malaysia and Japan, I think this is a lesson that we have to take it in and to work together in the future for better results. Thank you very much for your attention.
Thank you very much, Dr. Shinji Akitomi. We would like to continue, but before that, we would like to apologize to our Facebook Live viewers. I think the English audio is not coming in. We are trying to fix it, but if we cannot do it on time, we'll definitely upload it, the video, Dr. Akitomi's presentation, with English audio on the Facebook page.
So before we move to the next speaker, let me introduce him briefly. Chief Muhammad Said Al-Hudzari bin Ibrahim, currently a General Manager, Program Development and Operations of Mercy Malaysia. And in 2011, he received a International Diploma in Humanitarian Assistance from the Center for International Humanitarian Cooperation, Fordham University. Among his major involvement in disaster includes, since March 2020, he was appointed as a Program Advisor, COVID-19 Pandemic Response Operations. And then in 2016, he was a project manager in Bosnia flood recovery operations. In 2015, he was involved in Kelantan post-flood operations. And in 2016, he was a program manager for the Pakistan post-flood operations. And other involvement, under his involvement is currently he is advisory committee of the Penang Green Agenda and also trainer for Malaysian Technical Cooperation Program for the Disaster Risk Management Training Program since 2011. So the session is yours, Sheikh Muhammad Said Al-Hudzari bin Ibrahim.
Thank you very much. Thank you, Dr. Matsura and Dr. Aznah, Your Excellencies, ladies and gentlemen. So let me just open my slide. Okay. All right. Okay. So basically, my presentation today, so I mean, I'm going to share some of our experience responding to the flood situation here in Malaysia during a pandemic. I will give a bit of a background about Mercy Malaysia, about what is an NGO and what is a function of an NGO, and how we usually determine or run our operations, just to give a bit of context, so that when I move on into the responding to a disaster during a pandemic, we can see the changes that we have to go through. So a bit about Mercy Malaysia. We are an NGO registered in Malaysia under the Societies Act. We were registered in 1999. So basically our vision is to be outstanding in delivery of medical and humanitarian aid. We are a non-profit organization. Our main focus is on medical relief, sustainable health-related development, and risk reduction activities. So when we talk about an NGO, so these are among the characteristic of an NGO. So usually an NGO, I mean, I put here NGO, CBO, civil-based, community-based organization, FBO, faith-based organization, CSO, civil society organization. I mean, basically these are almost the same. It's the same concept. It's all community-based, voluntary type of organization. And then it's formed by volunteers to deliver charitable, humanitarian, and development activities. We function at local, national, regional, or international levels. So we address a wide variety of issues beyond humanitarian assistance, depending on our origin and inspirations, whether it's religious, political, social reform, and so on. And NGO is usually governed by the country's law where it's being registered. So for Mercy Malaysia, we are registered here in Malaysia. So we are governed by the Registrar of Society and also our own constitution. Also to mention that we are not necessarily, I mean, the line ministry in Malaysia or in any country does not necessarily determine or dictate the NGO area of services or operations. So the main role of any non-government organization is basically to fill in gaps, assisting the government in fill in gaps. So we are not the first to come or first responder in a way. We are also not the last resort. So we are there to fill in gaps where it's found in collaboration with government entities or whoever is running the show. And NGO is usually a grassroots organization, so which means we are more nimble, restrictive, and then we have greater access to community because we speak the same languages, and then we are there with the community and so on. So this is just to show the common operation approach of any organization. It may differ from one organization to the other, but basically it involves planning, implementation, evaluation. What we say when we talk about planning is about needs assessment, stakeholder analysis, logical framework. We do fundraising, we allocate funds, or we fund resources to fund our activities. And then of course we do stakeholder engagement when we do the implementation, procurement activities, supply chain management, volunteer mobilization, monitoring, reporting, etc., including all the delivery of medical, healthcare activities, mobile clinics, distribution of food packs, and so on. So those are part of the implementation. And then after that, we have to do our reporting. We do final evaluation, decide on project continuation, decision, and whether we need to further respond to the situation. So this is the common approach how any type of NGO or organizations like us usually operate. So I can show you, this is from IESC. This is from the UN actually. So it's the same concept basically. Needs assessment. And then you have the strategic planning, resource mobilization, implementation, monitoring, and then operational peer review and evaluation. So this is from IESC. You can study this yourself. If you look into ECHO on project management cycle, I mean, they have like the same cycle, the same concept as well. So this is the very common way of how humanitarian organization determine what activity they want to undertake based on their vision and mission, and then later on decide to respond. So in earlier this year, we had a situation whereby in Malaysia, the monsoon season is very common. So we usually have flooding at the end of the year, up to the first part of the year. This is a very common situation. The only difference with this year flood is that it happened this year in the midst of COVID-19 pandemic. So we were in the midst of the third wave of the pandemic, and on the same month where the flood hits Malaysia, this year we went into the second phase of our lockdown, or we call it here the MCO, Movement Control Order. So this is the situation that we had to go through for this year. So how do we manage a response during a pandemic? So we had to review our operations. Of course, we had done the revision before we actually entered into the response, just because we started to respond to the pandemic itself somewhat last year. From the beginning of the response, we were involved coordinating with the Ministry of Health, to come up with various activities. We had to mobilize our volunteers and so on. So even then, back in 2020, when the pandemic started, we had already reviewed some of the processes, procedures that that we have to undertake, changes that we have to make sure that we are able to basically deliver our assistance without going against SOP or any types of regulation that the government have made during the pandemic. So number one, identifying needs. So when we usually we would go to the field to identify needs, but during a pandemic situation, definitely this is not something that we would be able to do. So we had changed our strategy, and we depend a lot on local NGO, community leaders, religious leaders, to get information on what is needed on the ground. So there's that kind of approach rather than sending our team to the field. Number two, in terms of verification of information, we had to do remote assessment. Usually we would go to the field to assess ourselves, what are the situation, condition, and so on. But it is not possible at this point of time. So we had to move into remote assessment, get somebody on the ground to assist getting the information for us, and then try to verify whatever they can from the information. And then number three, a more simplified process. We had to review our processes, because usually when we do a response, we would send our people to the ground. Our people meaning our staff. They are trained. They have they know the process, procedures on how we do information. We collect information and so on. But right now we are depending on different people. So we had to simplify the process a bit. We came out with a standardized format of reporting. We depend a lot on technology, WhatsApp on real-time pictorial report and so on. So this is just ways for us that we had to change in order for us to accommodate with the current situation. And then, of course, we had to go fully local. I mean, localization was the way to go for us. We asked volunteers in each state to basically assist us in leading the operations. We asked grassroots communities, religious leaders, and community leaders, basically to lead distribution or activities on the ground. We had our state chapter and so on. In each state, whereby they are the one who we mobilized when we did the implementation of our programming. In terms of risk mitigation, we had to revise our policy for volunteer mobilization in a way to accommodate the current situation, because we had to know what to do if in case some of our team member got infected. So we review our policy, and then basically we shared with them. We had we revised our disclosure forms and so on, so that if in case there are anything should anything happen on the field during our response, we know what is the next step. They know what is the next step to do. There's no panicking and so on. And then last but not least, we had to decentralize our monitoring system. but through a centralized data management system. So everything went through HQ still, but we depends on, again, to the local community, to our team on the ground, to basically assist us in monitoring those activities that we had conducted. So these are just to showcase some of the pictures of we using local community leader, other organization to support our response activities on the ground. So what are the opportunities? So basically, when we did our response during the flood situation, during a pandemic, so we found that because the COVID-19 SOP and protocol was introduced much earlier, so physical distancing, I mean, they are aware about physical distancing, which means each evacuation center had less people. So which means, I mean, it's easier to manage. So there were proper SOP issued for NGOs and aid worker. And to be honest, before, I mean, there were only some general guidelines from the, we call as the Directive 20, but with COVID-19, there is like a proper guideline on how NGOs can manage their response activities, which is very good, which is a way forward. Number three, we can see communities are more disciplined to ensure SOP are being followed. So you don't see people crowding around because they are aware if they are in evacuation centers, so they have to be more disciplined in order for them to avoid being infected or spreading the disease and so on. We understood that preposition of relief aid comes very important, especially in this time around, because of the travel restriction. We cannot send items a lot from central warehouse, so a lot of our responses depends on the preposition that we had on the ground. And finally, centralization of relief. The government decided to centralize the relief. The coordination center in each district became the main place for us to go in to get information and conduct our activities. So which is good. Everything is more organized. But okay, so these are among the guidelines. I'm just putting some of the pages from the guidelines. So the guideline itself is there. So this is guidelines for evacuation center management. It was issued last year on the 6th of July. So this is for guidelines for response agencies and bodies. It was issued on the 12th of January this year. So these are among the things that is new and has basically improved the way response has been done during a pandemic. Some guidelines were issued by the local government themselves. So these are one of them by one of the district government. So they stated there, what NGOs who are coming from other states needs to do in order for them to go to respond to any other states, and then they need to take the RT-PCR test and so on. So what are the challenges? So among the challenges would be coordination, definitely, because physical coordination meeting was nearly impossible. I mean, I'm not saying that they're not having it, but it's very hard for you to get everybody who is responding to in one room, because it's not practical and it's against the SOP. And virtual meeting in a disaster situation means people have to be in front of their PC, laptop, and they have to have connectivity. But when you are on the ground, I mean, these are issues that you cannot address. So coordination is quite impossible for many organizations. There's no immediate access to critical information in terms of gaps, identification. So sometimes it leads to duplication and delayed response, and so on. This is especially for communities staying outside the evacuation center, whereby they had like nowhere to provide the information to. So yeah, so this is very troublesome for most NGOs because there's no information available for us to review and so on. Again, I mean, we were instructed to go to the Central Coordination Center, but not all the information is there. Then we also had the communication issue, whereby it's good enough for the coordination center, the disaster coordination center, to become a call center. But then again, there are issues concerning, whether they were adequately prepared. So that was among the issues. There were some NGOs trying to call the centers, but it was not answered. So I mean, those are among the things that we thought that, I mean, it could be better prepared if we really want it to be really centralized. And then while SOP for communities and management of evacuation centers are there, it's from last year, since July, but the guidelines for NGO only came about this year, and it was really after the response had already begun. So again, the timeliness of some of the SOP to come out, I mean, led to some incident as well. So while there were almost no cases among the evacuation center, so there were a few clusters found among the NGO itself. So these are among the 3 that I could found. So on the 3rd, I mean, begins the response itself. So there were 1 cluster identified on the 20th, 22nd, there's another one, and then on the 25th, there's another one. So these are all related to the response itself, and then unfortunately, it affected the responder or the volunteers from the NGOs.
1 or 2 minutes, please.
Sure. So yeah, so as a conclusion, the COVID-19 pandemic has opened up to more opportunities, I believe, for improvement in national disaster management policy. There are lessons learned, best practices that could enhance our disaster risk management in the country. Among those, better coordination mechanism, we can look into that, how localization could improve disaster management in the future. Capacity enhancement, definitely, communities, partners, and local stakeholders, and also things like a unified response plan to be come out with and then shared by to the rest of the organization, so that we are achieving the same objective when we respond to any type of disaster in the future. Number 2, data and information management has always been the crux of any response or of an effective disaster coordination in the country. So improvement in the way data is being collected, analyzed, shared with relevant responding agencies or bodies, including NGOs, may change the efficiency of the response activities in the future. Because again, I mean, this is not something new, but this is something that could really change the way response is being handled in the future here in Malaysia. Because we know right now it works, when we centralize the response to the PKOB or the Disaster Coordination Center. It's just a matter of how do we share information about what is needed on the ground, and then what are the gaps, I mean, who have been where, and what are they doing. So these information are critical information for us responder in order for us to do our planning. And then last but not least, while responding to any type of crisis would usually mean going back to the basic, meaning we only provide basic things during critical time, but the response approach can be done in a more innovative ways. So I think it's about time for us to think whether cash or e-wallet may be a more practical approach in this kind of response. So that is number 1, and an example. As compared to in-kind, because in-kind you have to hand over the item, so which increases your risk. And then number 2, in terms of assessment, data collection, how about crowdsourcing assessment? We depend on the local community to provide us with the information rather than we send people to the ground. So these are the kind of things that may be considered if you want to look how response can be effectively done or considered in the future. So that's all from me. Thank you very much.
Thank you very much for your insightful presentation, especially from the field, from a community-based organization perspective. We would like to continue with the next presenter, Dr. Naoki Sakai. He's the Chief Researcher of the National Research Institute for Earth Science and Disaster Resilience. We call them NIED for short. They're based in Japan, of course. Dr. Sakai, just to briefly introduce him, he's a geotechnical engineer, specialized in soil erosion research, simulation for slope failures and monitoring. But he also looks into many of the social aspects of disaster management as well. He's also our MDRM lecturer in the geohazard engineering course. And he's also in the past taking part in JICA JST SATREPS project in Malaysia. So he's very familiar with the Malaysian situation as well. So without further ado, may I give the floor to Dr. Naoki Sakai.
Okay. Thank you, Dr. Matsumura. 私は、ちょっと今共有をします。
Let me share my slide with you. Can you all see the slide?
Okay. 大丈夫ですかね。はい、じゃあ。
Is it all right? So if that's the case, I'd like to get started. Our research institute looks into disasters. Is it moving the slide? Is the slide operating?
スライドショーにしていただけますか。
通訳も出てる。大丈夫ですね。じゃあ、はい、続けます。
So let me continue then. In terms of disaster prevention, the most important thing is what is happening at that point in time. How is it happening? That knowledge is crucial. And to know this information, oftentimes you need to have sensors in place measuring the situation. But when we're dealing with disasters, it's a type of warfare. You need to know your enemy in order to take action against it. And in Japan, we have earthquakes, volcanoes, tsunami, flooding, landslides. And now that it's winter, we also have winter disasters. A wide variety of disasters, natural disasters takes place. I've had a lot of experience here in Malaysia, but I would like to focus on the kind of water-related disasters that happens frequently there. The most crucial thing when we talk about disaster prevention is how we can protect the lives of people. And today I'll be focusing specifically on flooding-related situations. From 2011, I've been involved in landslide as well as flooding related research in Malaysia. And then I've also been involved over at MJIIT in reducing these kinds of damage. And I've also gone to East Malaysia on site to check about earthquake and flooding related disasters. In recent years, the disasters that we see have these following characteristics. In 2014, there was very heavy rains, and in the lower half of the Malaysian peninsula, there was a lot of flooding related disasters that took place. In Japan as well, in 2019, we have this kinds of water-related disasters. But when you have these kinds of events that happen, normal societal functions get interrupted. And also this kind of coverage by water ends up disrupting the normal workings of society. In recent years, what we are seeing is greater frequency of such kinds of disasters, which happen on a much larger scale with greater complexity. And as we prepare for these kinds of hazards, this time around, we've also had to deal with COVID-19. And what's critical in this situation is we were unable to know the details of COVID-19 initially. In Japan, we have a very centralized society whereby all the functions, people are centralized in Tokyo. And then in relation to that, COVID-19 impacted this key function of the state, and it has had an impact. Now that mobility is restricted, we are being forced to operate as an independent and decentralized society, and different regions are functioning on its own, and people are separated. In terms of lifestyle, perhaps this is a more ideal situation, but the biggest problem now is that we still don't know the particular characteristics of COVID-19 even today. And so we don't know what's the best way to go about with our daily lives. And in Japan, we are looking at how we can establish local resiliency. So today, I'll be talking about how we should look at local resiliency under COVID-19. And the three key points under this new normal is to be able to practice contactless, remote, as well as a more digitalized type of life. So how we can best make use of these kinds of new approaches. And so we need to also understand the technology and know-how behind all of this so that the persons in charge are better able to make the necessary decisions. So here we have a framework for cyber-physical resilience system, which we believe will be key. Conventionally speaking, we focused on prevention, disaster response, recovery, and they operated separately from each other. But in recent years, now that we can get more information at once, the idea is to create a cyber system where we can integrate this all at once.
So digital transformation, this is more data, more information coming into that. So we have to grasp all the information, then utilize all the information, then using all the information to contribute the three phases. So this is a cyber physical system. Another point is actually it requires the basic skill, communication. Communication has to be conducted within the same level of information and the technologies. So this is the part education should cover. Then next, what should we do to do that? So our lab, institute, so science and technology, this is the modeling, information products, delivery. This is the point that we are very expert in. But on the other hand, in society, demand is the action. The society demands the action. So this is a product, point is a product. So deliver the product to the society for them to take an action. So science, technology, our part, the interdisciplinary, and all the others, all the phases. So these features have to be connected seamlessly to connect to the society. So information and action. This is a key point. This is how we can comprehend, integrate all the features in our system. There is a phases in disaster, the normal and then detention and disaster, the emergency, evacuation and recovery, and the construction. This is the phases in the timeline. And particularly, the most panicking area is a 70 hours. This is a fact. After the evacuation and after the protecting the life, how to conduct, how to recover to the life. This is a point, another point that we have to challenge. So this is a point I focus on to talk. So I would focus on my talk, this point. In Japan, there is evacuation, is registered already. Law has to define the evacuation. Then normally safety action, see the safety action. So we are moved, those of the disaster victims are moved to the safe shelters. But because of COVID-19, it's not safe enough now. So we have to improve the condition, environment, situation of the shelter. So when disaster happened, so shelter, people move to the shelter. This is already regulated by the law. But there is some person who stay in the house. There's now people say stay in the house. Safety action is maybe stay in the house. So now it's defined the safety action is move or stay at home. So after that, you decided whether evacuated or stay. After evacuation, and it's after the sheltering. This is sheltering. So sheltering must be divided or defined with the safety action. However, to stay or move, decision to make a stay or move, but information is critical. Those who needs information, the information of the stay or move is very difficult to communicate. So now we come up to some innovation. So it's a house. It's a standard type of Japanese house. So when water come into the area or reverse flow of the water, so electric equipment or the protect from the electric equipment from the water, this is all the measures taken into the house, what the house has to be. So this is at least in how the house, inside the house, be protected from the water. So we did the experimental experiment. So this is actually in our laboratory setup. This is the laboratory. You can take it, the water, 3 meter height water. So existing type, this existing type is a conventional Japanese house type. Then this is the water level heightened 3 meters. So the house first floor have completely merged. And another this side, but this house is floating in the water. So the house floating, the water is not coming into the house. So water coming into the area, but at the same time, the house can float along with the water. So we implement such a technical aspect to the new house that we already confirmed that the water is not coming into the house. So we enhance the water flow strength or generate more strong wind to the house. Then we have to check whether whether affected by the strong wind or heightened water. This is also experimenting. So these are the house. So we are checking whether the inside the house are still safe enough or not. And also if evaluating information, the people must stay in the house or have to evacuate. So these are the tools. So it was very difficult before whether when the heavy raining coming, whether stay in the house or evacuate. It's very difficult to decide it. But nowadays there is some tools that we can decide or evaluate the situation of disaster. So this is now our innovation. The house, the water cannot invade into the house. So as long as inside the house is the safety protected, or in Japan there is a many aged society. So those who cannot evacuate, and then maybe they can be protected in this kind of house.
In the future, as we innovate in this way, the hope is that we can overcome various different disasters much more cleverly than in the past. In Japan, this kind of skill and technology is going to be further developed moving forwards. And many areas, sectors are trying to make use of this new know-how. By using the facilities we have within our research institute, we can try out different ideas moving forwards. And so, for example, in terms of flooding, we can come up with different alternative ways of dealing with the situation. Naturally, we'll have to come up with industry standards as we develop new approaches. But if research institutes like us could work together with the private sector, then this standard will become even more widespread. And for example, in these photos you see, we have sensors attached to the automobiles as well as the other devices, or we have radar devices in order to judge the effectiveness, and we are able to see what kind of impact the rain has on vehicles which are driving through heavy rains, whether they are able to deal with the levels of mud or water that is on the roads. But right now, this is the kind of research that we are undertaking in Japan at the moment. And when we do this, a transdisciplinary approach becomes important, and have the citizens as well as stakeholders like the infrastructure owners cooperate will be important. Equally important is sharing of information about the disaster with various stakeholders, whether it's the citizens or other industries and ministries. Traditionally, we worked in silos. It was all vertical. The land and transport ministry would work alone. The public works ministry works alone, and so on. And there was no centralized decision-making that was taking place. But this is an issue. So the idea now is to try and allow the information to be shared more horizontally and freely among different entities, and create a system that would allow this. And this is another undertaking that we are involved in at the moment. And so lastly, from me today, all this work that we have been doing especially under the new normal enforced upon us under COVID-19, is that we need to have a correct and accurate information of COVID-19 so that it can be reflected in the various plans and measures we have in place for dealing with different natural disasters. And so it's important to be able, what we do with natural disasters moving forward should not be any different from how we did from before, but with the added layer of the information and know-how that we have acquired after having learned about COVID-19. To do this effectively, it's important to have access to accurate information so that each region, districts are able to act accordingly in the optimal manner. There are many technology skills available to us, and to use them in an effective way is critical in allowing us to act in the most optimal manner. So it's important for all the participants, stakeholders to have a common understanding, not only within a nation, but also in the international arena. And by doing this, hopefully how we respond in reaction to natural disasters and COVID-19 could change for the better. That's all for me. Thank you very much.
Thank you.
Yeah, right. So I think we're still discussing with the same topic, coordinating the compound disaster. And after this, we will hear from the Malaysian experience with a specific title on the flood disaster response under COVID-19 by DCP Datuk Hussein Omar Han. So Datuk Hussein served in the police force for 25 years and in September in September 2019, he seconded to National Disaster Management Agency, NADMA, as Operations Director. And he graduated as a biochemist from the University of Malaya in 1994. And in 2019, he obtained a Master in Forensic Investigations from University of Teesside, United Kingdom. And among his major experience in disaster include tsunami in Aceh 2004, Sulu intrusion in Sabah 2013, and later he involved in humanitarian aid and disaster relief mission to Wuhan last year. And since joining NADMA, he has involved directly in coordinating monsoon flood rescue operations in 2019 and 2020, whereas in COVID-19 operation, he has involved as early as February 2020 in coordinating of several humanitarian aid and disaster relief missions and operating quarantine centers. Dato, the session is.
Thank you, Dr. Azna. Can you hear me? And
yes.
Thank you to Dr. Ahmad Shura, Your Excellency, honorable guests and distinguished guests. Very good afternoon and konnichiwa. It is an honor to be here to presenting on behalf of NADMA, National Disaster Management Agency of Malaysia, on coordinating compound disaster, especially a flood disaster response under COVID-19. So without ado, I will start to understand better what we experienced in last few months between COVID-19 and a flood, which I will say is a disaster within disaster. Let me share with you the situation of COVID-19 for the past a year. Okay, let me walk through COVID-19 containment measures in Malaysia. When it started a trigger in China somewhere in January 2020, as many other countries, Malaysia also issues advice against traveling to China. Following from that, on February to April, we had a few humanitarian missions to high-risk countries to bring back our citizens, namely from China, Italy, Iran, and Indonesia. Then in March 2020, Malaysia issued travel restrictions and compulsory quarantine order to those arriving from abroad. Then, when the cases increased, we had our first lockdown. We call it MCO, Movement Control Order. It lasts for about 2 months between 18 March and 12 May 2020. Then we have a better situation. Then we enter into recovery MCO between 1st September to 31st December 2020. Unfortunately, the case become intensive, and Malaysia declared a second MCO. We call it MCO 2.0 between middle of January 2021 until now. And we started our vaccination program somewhere early March this month. And if you can see the bar chart for the past 2 weeks, it shows sign of abating of cases in past 2 weeks. So we are in a better situation now, and we're hoping the declining trend will continue, and the cases will become below 500 per day, and the R0 will become below 0.6. Hope you will achieve that. And in other hand, let me share with you the situation of flood, which we just passed between from the last November until middle of January. If you can see the map of Malaysia, which consists of 2 non-contiguous area: East Malaysia, there is a Peninsular Malaysia on your left, and the right one is West Malaysia, island of Borneo. The land size almost equivalent, slightly smaller than Japan, is about 330,000 square kilometer, which are occupied by 33 million of population. When the flood happened in that particular time, out of 14 states in Malaysia, 13 states involved in that flood. And if you can see, each state, if the cases evacuation more than 1,000, it become we label as a red. And between 500 to 1,000, we label as orange, and below 500 evacuates, we label as yellow. So you can see we open about 1,147 evacuation centers. It's involved 33,551 families, and evacuees amount to 125,817. And of course, we have a number of casualties, about 16 fatal casualty involved in that flood season. So that is a flood situation which we just passed through end of last year and early this year. Okay, let me share with you as well. The flood in Malaysia is an annual event. We definitely will go through this this disaster. It's just different in terms of magnitude. If you see, 2014, 2015, we have biggest flood in our for the past 10 years, which affect 2% of our population. The evacuees is above 500,000. And 2015, 16, we have the impact is small. Then 2016, 17, slightly higher. And it better, 2017 and 18, and 2018 and 2019 is very much better. But last year and this year, the magnitude is quite high. So what I want to show you here, yes, definitely every year we will go through this monsoon flood, and we have a time to prepare, and it become our annual event every year. Okay. So as mentioned, Malaysia, we experience two distinct monsoon. It's a southwest monsoon and also a northeast monsoon. The worst is northeast monsoon, which will occur between November to March every year, which brings a heavy rain. As I mentioned, it's an annual event which brings significant damage and in terms of human life loss, property, crop damage, and also other losses. Last year and this year, we have to go through this in a pandemic of COVID-19. And for that, how we overcome, or NATMA coordinating with the other responder agencies to come up with a special SOP for managing disaster during COVID-19. Especially is a guidance to a responder team as well as an evacuation center, how you'll be going to operate in this compound disaster. And this SOP will be implemented by the Committee of Disaster Management at the level of state and district. Let me share with you how the structure. You can come up with whatever SOP, but the most important is how we're going to materialize or implement in different levels. So in Malaysia, we have a federal government, and we have 14 state, and we have about 160 districts. So there's a 3 level of management in terms of government agency and also responders. So if you see, we have a mechanism under National Security Council Directive number 20, how we operate or coordinating a disaster. So at the federal level, we have a disaster management relief committee. We also have at a state level and also at a district level. In between, we have a NATMA as an agency to coordinate the whole at the federal level. And we have a state civil defense as a NATMA secretariat and also at district level. Here where we have a National Disaster Control Center, NDCC, State Disaster Control Center, and District Control Center to gather all the information and coordinating any operations. Of course, at the scene, we have on-scene posts headed by Chief of Police. So in Malaysia, Chief of Police is a commander at the scene to coordinating all the disasters or activities. Moving toward how we successfully overcome this flood disaster within epidemic COVID-19. Firstly, is a compliance to standard operating procedure before, during, and after rescue operations. Secondly, a disaster operating command center to be activated so that all the information can be channeled in proper level of command, and also information and also direction can be either from bottom to top or top to bottom. And to identify disaster risk area, hotspot, flood, and pandemic, so we can prepare much earlier. And we request the Minister of Health to share information within a multi-agency in terms of location of COVID-19 cases, person under surveillance, home surveillance order with the responders, so that we know which zoning area they are, either it's in a red area or it's in a green area in terms of COVID-19. Then we have adequate protection. We have to prepare and we have to provide to the responder PPE, face mask, glove, PPE, whatever needed prior to the flood incidents. And we have daily checkup either for the frontliner or for the victims as well. The other important thing in managing or coordinating this compound disaster, especially the flood, is the shelter, the management of the shelter, temporary shelter or temporary evacuation center. Firstly, we have to identify prior to the flood, what are the area or the facilities very suitable to become a shelter. Because in a shelter, we will have a high number of flood victims. And that is where is the area of high risk for transmission of COVID-19. If we didn't handle correctly, it will be a disaster as well. So our preferable facility is a schools where we have a room, school classes. We can have a physical separation between one small group of between family to family. So measures can be taken and practiced by all evacuees and all agencies responsible for the management and welfare of the center. Then evacuation center location, we limit whoever from red zone, they will be in a red zone evacuation center. Whoever come from the green zone, they will be in a green zone evacuation center. It will be easier for us to manage. And we come up with a new policy compared with the usual. We limited the capacity of the facility only for 50%, and we provide a big number of collapsible tent for each family, so there will be a separation between one family to another family, and the distance will be a 1 to 2 meters spacing between them, between the collapsible tent in a classroom. So if you see in a picture, that is how the collapsible tent look like, and easily between 4 to 5% can be housed in a collapsible tent. And our past experience, we will open this temporary shelter between 3 to 7 days, which that was the time they have to be in a displacement of flood victims before they can go back to their own house. The other thing I like to stress is the food in terms of providing them a food. Previously, we do practice communal works to prepare the food, but at this time, in compound disaster, we can't do that. We prepare packed food. That means only packed food will be distributed directly to the victim. And we also regularly disinfect common area to be clean. And we do have a regular checkup whoever occupy this temporary shelter. And we also allocate a special isolation area to be housed whoever evacuees they're having symptoms before can be attended by a medical staff. And at a temporary shelter, we in our new SOP, we always advise them to have a safe social distance, keep hygiene by regular hand washing with soap and water, register themselves with their handphone in our application, so-called MySejahtera application with the QR code, so that we know where about this person and when they are check in, when they are check out. And the other significant things we amended in new SOP is no visitors allowed. Previously, before the pandemic COVID-19, there is family members come and visit, other NGOs can come and visit. So at this time, we zero visitors at these centers. And we also limited movement in and out between the evacuees, only allow the head of family to get their family needs. Evacuation centers will be provided with a 3-ply face mask along the duration of the they staying in the temporary shelter. Hand sanitizer will be placed in a strategic location such as main entrance and exit of the center. Of course, there will be a signage, poster, markers to inform about the new norms, to avoid 3 Cs, practice 3 Ws, avoid shaking hands, touching, no gathering, and things all. Okay, as I explained to you, all the SOP, how we come out with the SOP, how we educate the frontliners, as well as the evacuees, the victims, in terms of new norm and the new SOP, so that they can practice either at the time of operation, evacuation, or at the time they stay in a temporary shelter. So I will say with the cooperative and support from all the agencies involved, we are able to come up with the no COVID cases have been detected at the flood evacuation centers nationwide for the period of 2 months in a compound disaster period, shows that the SOP had adhered to at the evacuation center by evacuees and related agency. Secondly, effective and successful reductions and management of compound disaster risk critically depending on our understanding of the connection and mechanism of the hazard. So we prepared, I would say we prepared much earlier, and the preparation helped us to go through that compound disaster period successfully. Without, I end my presentation. Thank you very much.
Thank you very much, Datuk Hussein, for your insights from NADMA, the coordinating agency of the government point of view. Thank you very much. Yes, so we're coming towards the last portion of our webinar. And we'll head right into the panel discussion. So please, I hope the 4 expert speakers are still online. We'll be asking some prepared questions that I prepared with Dr. Kamaru. And also some questions we'll pick up from our audience online. We'll try to pick up as much as possible, but again, we're kind of running out of time. And if we do run out of time, we will try to at least answer your questions after the event. We have the records of all your questions, so you don't have to worry. Okay, so we'll start off with, well, again, introducing our 4 expert speakers who will be our panelists. So again, Dr. Shinji Akitomi from Japan, and Mr. Said from Malaysia. Dr. Naoki Sakai from National Science and Disaster Resilience, Japan, and Dato Hussein Omar Khan, Director of Operations, NADMA, Malaysia. Yes, so, well, we'll start with easier question that we have. And this question is addressed to all 4 of you. Yes, so I want you to maybe choose and explain one good practice and one significant challenge that you observed during this COVID-19 response. It is ongoing. But perhaps we're starting to also talk about preventive measures as well. Well, you don't have to explain so much in detail, but can you maybe choose one good practice and one significant challenge from Japan and Malaysia, maybe in your line of work? So we'll start with Dr. Shinji Akitomi. In the order of the presentation, yes.
As far as the citizens and the politicians, all of them were very serious in dealing with this pandemic, which was a good thing. But the thing with COVID-19 is that initially in Japan, it was just the medical professionals that were giving input on what to do in response to this pandemic. But it was also necessary for economic sectors to also provide input. And this happened subsequently, which I think was a positive point.
And maybe you can tell us an example of the biggest challenge maybe Japan faced in COVID-19. I think it's still ongoing. I think Japan is still in a state of emergency, but if you would raise one challenge Japan has faced or facing, can you give us an example?
There's actually too many to mention, really, but the biggest one at the moment is the fact check. There's so many rumors going out about, and the public information in order to reassure the public how to distribute that continues to be an ongoing problem, which I think we need to resolve.
Okay, thank you very much. Again, the reminder that for any information in this panel discussion, the audience may still ask questions through the chat function in the comment section. We will take note and we will try to answer them when we can. Yes, our next speaker, Mr. Said, perhaps you can give one example from Malaysia as well.
Sure, thank you very much. So I think in terms of good practice, I would say decentralization of response effort and also process simplification. That would be something that that would really help, because it helped us in managing the whole situation, whereby we strip down to the most basic processes in terms of planning, reporting, getting just the right information for us to make decision making as soon as possible, and then using technology just to help us with the reporting and so on. So I mean, that would be decentralization would be one of the best practice that we think would help. In terms of challenge, of course, in Malaysia itself, I mean, there are still large gap in many places among Malaysians, among local government units, community members about disaster risk knowledge. So, I mean, this poses quite a challenge, for responder, including NGOs like us, because in an ideal situation whereby if disaster management or disaster risk and its management is being understood, so of course the grassroots, the community would be able to be the first responder, assist with information, giving out information, coordination and so on at the initial phase of the response itself. But since it is something that is still, I mean, there's still a gap there, so I mean it really poses a challenge whereby the respondent itself have to to depend on themselves or the authorities to get information on the ground, just to make sure they are planning properly, there's no duplication, there's no oversupplies and so on. Thank you.
Thank you very much. Dr. Sakai, how about in your disaster research, and then this COVID-19 coming in, what is your idea, or how do you see this challenges and maybe a good practice that you've seen in the science field, perhaps?
In Japan, we have so many different natural disasters, and we've been trying to make it all visualize. And with regards to COVID-19, how we should make use of what kind of information in order to make it more visual for the citizens. That was the tricky part. we had great difficulty in that. And also in terms of the evacuation centers, how we should deal with that, having 2 meters spacing in between, that we were able to do quite well. But when it came to the question of who should actually leave their homes and go to the evacuation centers, that part we still have yet to iron out, who to turn our attention to. Information is starting to become more readily available, and we are able to better interpret and figure out who should be evacuated and so on.
Thank you very much. Very interesting. Datuk, saying perhaps as a coordinator of natural hazard as well as this COVID pandemic, can you give us maybe some good examples you've seen and also the challenges that you saw?
Thank you, Doctor. From my perspective, one of the good practice that produced to success is the placement of MCO, movement control order, and the enforcement. When you restrict people, it's really challenging to the enforcer to restrict movement of people. So you have to go light approach when you do the MCO, and later come to a point you change to firm approach. And this MCO is really give a tremendous impact in control COVID-19. And the challenges is to sustain how the people comply in this MCO. Because after 2 weeks, after 4 weeks, people started losing their job, source of income, because they cannot go to work. And how government come up with the measures to help them. And after a while, people become a bit flexible, and where we have a problem to make the people comply to the MCO. That is a tremendous challenges for the enforcement agencies. So I will say this MCO is really a good practice to cordon COVID-19. Thank you.
Yes, thank you very much. There's always a trade-off in disaster management as well as crisis management, and it's very tough job for NADMA to really balance these two out. Thank you very much, Dato. So the next question from Dr. Komarung.
Yes, thank you very much, Dr. Masura. I think we have a long list of questions, Dr. Masura. We would like to apologize to those who wish to all the questions are answered within this limited time. So what I'm going to do, I will pick it up some of the interesting questions and blended into the predefined questions. Yeah. So, well, of course, I just want to echo the question raised by Dr. Matsura just now to Dr. Hussein. And well, of course, we wish to hear more story from NADMA. And if I can, well, quote this, well, in the recent monsoon, I think you did mention in your presentation that there is a zero transmission in infections, and we are talking about 17,000 displaced people, yeah, evacuee, and these temporary evacuation centers it's like a perfect place for the virus to transmit from one to another. But I think the PPC teams also in the field and observe some of the practice. And perhaps Dr. Hussein, if you can, very limited time, if you can share with us what are the key ingredients that, to translate some of the policy into practice. I know that it's not an easy process, but if you can share with us some of the a key ingredient and perhaps untold story behind this remarkable achievements indeed, not only NADMA per se, but a Malaysian Civil Defence Force as a Secretariat of Disaster Management Committee, Department of Social Welfare. I think if you can provide us some, share with us some of the key ingredients, Datuk, please.
Thank you, Doctor. It's a pleasure to share here how Malaysia successfully come out with this disaster within disaster when handling a flood in COVID-19. Firstly, I will say the SOP itself. You prepare the SOP, but you must channel and let people understand, because you have a multiple agency as a frontliner, and you have a various area, rural and also urban area, that you have to let the frontliner understand what is the SOP about and how to implement it, because different people different interpretation of SOP. So we have a series of roadshow and also meeting to explain about the SOP. So secondly, we have a very good cooperation and also support from the frontliner. That means that makes it easy for us to implement what we intend to do and what we hope to do. And thirdly, I would say previously, before the pandemic, when we are having a flood, we have a number of NGOs and individual groups directly go and approach the victim to offer their assistance, aids and things all. At this time, we say no, totally no. You can't go directly to them in the pandemic 19. You have to go to our coordination center, handing over there. Then we have a proper dedicated team to distribute whatever contribution or aid that channeled through NGOs and also individual groups. So that I would say really help us in condone this handling of disaster within disaster. Thank you.
Thank you very much, Mbak Datuk. Well, I wish to hear more story from the field, from your experience indeed. And if I correctly understand that you were also in the mission to Wuhan last year. Perhaps in the other occasion, we can invite Mbak Datuk to share a bit more. Perhaps Dr. Matsura, some more questions?
Yes, I would like to pick up one question from the audience, online audience, maybe addressed to Dr. Akitomi and Mr. Said. This regards vaccination, which all of us are kind of interested.
Yeah.
I'm wondering when you know, we'll
still waiting.
Still waiting. But this question is regarding well, the foreigners in the country, and well, the question actually specifically asks about the asylum seekers or the refugees. And maybe some undocumented, you know, foreigners, you know, they also need the vaccine, but maybe we don't know their existence, but they could also be the carrier of the virus. So I think they need to be incorporated into the vaccination program, obviously. So I want to know how Japan and Malaysia is we're planning to do with the vaccination for foreigners, maybe specifically for these undocumented people. Yeah. Maybe I should ask this question also to Dato as well, because it's more on the governmental issue as well. But Mercy also work with refugees, so I think if you know anything or suggest something, perhaps you could also give us some ideas. So
I can start.
Yeah, please.
Yep, sure. Thank you very much, Dr. Matsura. So yeah, I mean, in terms of vaccination for the foreigners, including migrant, you know, undocumented migrants, refugees, stateless, and so on. This was made clear by the by the minister in charge of vaccination that it's going to be covered. So we had already a few discussion with UNHCR, with the government representative on how to basically roll out this vaccination program for the non-Malaysian, especially for the refugees and the non-registered migrants. So plans are already underway. Of course, I mean, they are going into the third phase of the vaccination. Priority is given to the Malaysian, to those who have like comorbidities and so on. So, but there are already plans underway, and it's being. I mean, the vaccination cost itself is being covered by the Malaysian government. I mean, the logistics of it. I mean, it's being discussed with the United Nations, including UNHCR, UNDP, and so on, and also WHO. How to roll out this. We, as the civil society, NGOs have been invited as well. So we have agreed as well to support the programs to deliver the vaccination through our medical clinics and then through setting up like vaccination centers in certain concentrated areas, because we have been working with the refugees, stateless, and so on. We meaning all the civil societies. So we know the pockets and places where these people are staying and how are they getting support or assistance. So we are going to go through those channels with certain NGOs who's covering. Certain NGOs are covering stateless in Sabah. Some are covering like the refugees issues here in the Klang Valley. Some are doing it in Johor and so on. So we are going through this NGO channel and then try to ask them to spread the information, to get them registered for the vaccination, and then we want to make sure that there's no action going to be taken by the government, because this is what has been the commitment from the government for them to go and get vaccinated. So I think we are speaking the same language as the government. We are going to support them in rolling out the vaccination for the non-Malaysian, including refugees, stateless, and so on. Thank you.
Thank you very much. Dato Hussein, do you have anything that you can add to that from the government?
I just concur what Syed said. I think he elaborated in detail Malaysia's government plan. All are in the list, but it will be in phases. Thank you.
Thank you very much. Dr. Akitomi, I'm wondering if you know what
Akitomi 先生、
Japanese government is towards
日本の政府としては、何を考えているかご存知でしょうか。共有していただければと思います。
はい、ありがとうございます。
Thank you very much. With regards to this, I'm actually not in the loop, and I suspect that they haven't still reached that stage of discussion yet. With regards to the vaccination, we have a public health insurance system whereby all citizens are able to receive treatment. So I believe we will be making use of this to deliver vaccines to everybody in the country. But at the moment, actual vaccination still hasn't progressed to a great level, but we'll be paying attention to that as we move forward.
Thank you very much, Dr. Akitomi.
Yes, I know now that time is our enemy, Dr. Matsura. But I wish to have one question to my sensei, Dr. Naoki Sakai. I think as a director of Center for Advanced Research Facilities in MJIIT, perhaps you can share with us about Build Back Better. I think now we are moving from response to recovery, but perhaps, this crisis come with opportunity. Perhaps you can share with us within these limited times, what would be the best way to come back, build back better and faster? Any advice, Dr. Naoki Sakai, please?
そうですね。やっぱり今現状をちゃんと把握を
to understand the current situation correctly, and then based on that, it's necessary to decide what to do moving forwards. Right now, people's lifestyles are changing as a result of the pandemic, and how we can take that into consideration with things moving forward. So for this, accurate information with regards to matters related to the pandemic is critical so that we can have the most effective recovery and reconstruction.
Yes, yes. Thank you very much. I think we come to the end, Dr. Masur. Yes. I wish to have another half an hour of this session indeed. But, you know, we have to respect the time. And maybe a few words before we close the Q&A sessions, Dr. Masura.
Yes, thank you very much, Dr. Komarol. And I would like to thank all the expert speakers today. I think although the expert speakers come from different expertise and background and roles and responsibilities for this COVID-19 and disaster management, I think we did kind of come to you know, a common kind of goal, obviously, you know, under this COVID-19 situation. And I just reflect back to what Tansri Dr. Jemilah gave us, the 5 points for approaching or overcoming this COVID pandemic. And I think from the presentations and the discussions we had today, I've kind of felt that we were kind of looking towards those 5 elements that we were suggested by Tansri. Again, I think there were other questions coming in, and we do take note. We will take record of those, and we will try to ask the panelists to possibly give us more insights in your questions. So thank you again to the 4 expert speakers. Thank you very much. And yes, so we will continue to our closing session.
Yes.
And our closing session will be given by a remark from Mr. Masahiko Takizawa, Chief Representative of JICA Malaysia office. So we'll give the floor to you.
Thank you. Thank you very much. Distinguished guests, speakers, panelists, and ladies and gentlemen, good afternoon. As Dr. Kamarulu mentioned, time is our enemy, so I will try to be brief. First of all, I would like to express my sincere gratitude to the distinguished speakers for making valuable presentations and sharing your insightful comments and inputs during the discussion. I would also like to thank UTM, MJIIT, and the Embassy of Japan for making this webinar possible and successful. This webinar highlighted challenges and lessons learned from recent experiences and ongoing experiences in responding and preparing for disasters. The keys for overcoming the challenges identified by speakers are surprisingly quite similar, such as better coordination among all stakeholders, government agencies, as well as the society, data information and digital transformation, and the translation of central policy into localized actions. It is my delight that MJIIT, an academic and research asset for Malaysia and Japan, plays an instrumental role in providing us with such a valuable learning opportunity. MJIIT project is one of the flagship cooperation projects between Malaysia and Japan, as Ambassador Oka mentioned in his opening remarks. JICA has been working together with MJIIT since its establishment in 2011. Over the years, MJIIT and JICA have developed very close relationship, and building on this partnership, I would like to discuss with Professor Ali and Professor Kamarulu to explore the possibilities for furthering cooperation in enhancing capacity for disaster risk management in the context of the COVID-19 pandemic. And for your information, let me briefly touch on JICA's cooperation in disaster preparedness and prevention, as well as the responses to the COVID-19 pandemic. Firstly, on disaster preparedness and prevention, JICA has been cooperating with DPPC by placing Dr. Matsura as JICA expert who successfully moderated today's discussion with Dr. Kamaru. We also offer a study visit in Japan every year for DPPC students. And due to the COVID-19 pandemic, we were not able to organize the visit last year, but we will do so when the situation becomes favorable. JICA also supports MJIIT Tohoku University Partnership Project for developing capacity in disaster risk management for communities based on proper understanding about disaster risks in the state of Selangor. I think this cooperation is quite relevant to the major points identified in this webinar. And in Japan, JICA offers a number of capacity building courses ranging from postgraduate degree courses to short-term intensive disaster risk management programs in partnership with Japanese universities, central ministries, local governments, and research institutions. And secondly, on support for the efforts by the government of Malaysia in tackling the COVID-19 pandemic, JICA extended modest contribution through the networks developed by cooperation with MJIIT. We provided personal protective equipment to the disaster management unit of Selangor in August 2020 and NADMA in February 2021, respectively. And capacity development is another focus of our cooperation, and JICA has been offering various research subsidies to UTM, MJIIT, and DPPC in order to help enhance research activities related to COVID-19 and disaster management. Currently, DPPC, NADMA, and JICA are undertaking a benchmark survey on disaster risk reduction and management capacity at the state level. This survey also looks into how local governments, organizations, and communities are coping with the COVID-19 pandemic. I hope the survey will help us identify possibilities for international cooperation activities. As I have mentioned, we have been working together with UTM MJIIT in many areas. Building on the close relationship and trust forged over the years, JICA would like to further promote mutually beneficial international cooperation in disaster management and other areas under the challenging circumstances brought about by the COVID-19 pandemic. In this regard, I look forward to exchange views with Professor Ali and Professor Kamarulu. In closing my remarks, I would like to express my sincere gratitude once again to the speakers and the panelists for inspiring inputs, which helped me understand the important aspects in dealing with compound disasters. This webinar is very meaningful for me and for the whole participants. My thanks also goes to the organizer and everyone who worked hard to make this webinar successful. And finally, I would like to congratulate Dr. Kamarulu and Dr. Matsura for the very good moderatorship. Thank you very much. Thank you very much, and terima kasih. Thank you.
Thank you very much, Mr. Takizawa, and for your encouragement for us to strive further in this field of disaster risk reduction and management. Thank you. So, Dr. Kamaru, you have some last minute
indeed, of course. Let's stay tuned. We have a couple of announcements, indeed. And once again, thank you, Mr. Takizawa, for interesting, remarkable closing remarks. And we hope that this DPPC effort can also strengthen future international cooperations, hopefully. And perhaps the committee, if you can share with us some of the upcoming activities, and for those who on the Zoom platforms and also Facebook, you can see on the screen there's a list of courses that offer under the flagship of disaster risk management. And it's also a great pleasure to have Professor Ali Slamet here, Dean of MJIIT, who always supporting our program. And if I may, a little bit, a couple of Second, well, this program has been on the market about 5 years, and we are co-designing, co-improving, producing a much more interesting product, courses, and not only to the frontliner, but those who are making a policy. So if you see the list of the courses, it's ranged from the policy, technical to the data management. I do hope those who are interested come and talk to us. And of course, JICA has been our great supporter and connecting with great professors and lecturers in Japan. And I do hope that we can expand these collaborations to support the PPC Transformation Plan 2030. So on my last notes, today, I think we are talking about 121 million cases throughout the world. I think we spent more than 2 hours to discuss a couple of experience indeed, and very limited time. And we hope that we can learn from the past so that we can better prepare for the future. And to close the sessions, Dr. Matsura, on behalf of the organizer, MJIIT, Embassy of Japan in Malaysia, JICA, we would like to apologize for any hiccups, technical issues during the event. And we will keep in touch, providing all the informations regarding the event. And perhaps Dr. Matsura, if you have anything to say to our audience out there, please.
Yes, thank you very much, Dr. Komaro. I just want to say that as a Japanese in Malaysia, it's very rewarding to get the experts together, get the knowledge together, learning from each other, and this is something that I wish to continue to do.
Yes.
And hopefully we'll be able to further strive in that way.
Yes. Thank you very much. Stay safe and hope to see you again. Bye-bye, everyone.